Has been called an absolute crisis. Tonight we are looking at a creative solution to help solve the logjam and endless cycle of mental health patients flowing into emergency rooms across Las Vegas.
13 investigative reporter Joe Bartel shows you the small crisis response team that's already making a big difference.
The 911 system was usually the first and really only option for someone facing a mental health crisis. But for years, the system became a cycle that many got caught up in. They are the first responders you don't see.
Tell me exactly what happened.
The first ones handling a mental health crisis over the phone.
It can be tense. Usually just try to talk to the person, kind of gauge where they're at, and find out, number one, are they open to talking to you? Are they going to be a voluntary patient?
Licensed clinical social worker Amanda Jordan is on the front lines too. She's part of a newly formed crisis response team riding on board a rescue rig and is now a first responder to a scene of a mental health crisis call.
They can be angry, agitated, under the influence, all of those things, but at the end of the day, we just want to see if they are willing to engage with us and cooperate in some form or fashion, and that's kind of where we go from.
The unit, formed just months ago, is already paying dividends.
We're outperforming expectations by some distance, and we think we're showing, good cost savings to the state. We're showing great care for patients.
Assistant Chief John Stevenson with Las Vegas Fire and Rescue says the old cycle looked something like this. A person in a mental health crisis called 911. First responders, oftentimes law enforcement, intervened and the person was sent to jail or an emergency room on what's called a legal 2000 or involuntary hold. They'd be released hours or days after the crisis passed, but their long-term mental health issues were not truly addressed. Some people repeated the cycle dozens of times.
That patient that would have gone 12, 15, 20 times may not have ever seen a case manager because they might have said, hey, look, whatever I was saying 2 days ago, I repudiate it, I disavow it, I'm good now, can I go home? And that doc might say, you know what, I'll let you go. They've got a crowded emergency room, there's no reason to hold somebody for something that they're repudiating from 2 days ago.
The new plan begins the same, but with a much different outcome. A social worker's on-scene assessment can change the course and direct a person to an outpatient, drug treatment, or a behavioral health facility. Plus, more immediate case management follow-ups can connect that person to other resources, finally breaking the cycle. From the approximately 1,000 calls handled by the crisis response team so far, nearly half have been diverted away from emergency rooms. The assistant fire chief says the partnership between public ambulance companies, Las Vegas Fire and Rescue, and public health entities is working, and there are plans to expand the program as funding allows. Joe Bartel's 13 Action News.